Hello, and welcome to the Dr. Toomer Talk Show. I'm Dr. Catherine Toomer. I'm a family medicine and community health physician and the founder of Total Weight Care Institute, where I help people maximize their health and wellness through metabolic health, metabolic weight management. So, welcome. I'm glad you're here. If you're listening, please tell me your name, tell me where you're listening from, say hello. And if you're watching later, and put in hashtag replay, and again, let me know where you're calling from or listening from. So the other is I always have a Q&A at the end of all of my lives. So stick around, ask your questions. It can be anything related to health, wellness, and weight care. I am a family physician, so really nothing's off limit. And please subscribe to my YouTube channel because that's where I provide a lot of my information. That's where I get feedback. That's where I get information from people who tell me what topics they'd like me to talk about. The other is, if you have a topic that you'd like me to talk about and I haven't covered it in one of my 300 videos, you can write to me at help@drtoomer.com and send me a message, let me know. Or if you just want to get a consultation, that's another way of contacting me. So welcome. Say hi. Who's here? Let me see. Joe Wellman. It's kind of hard to tell. They keep changing things. They call themselves updating, and every time they update, I can't find anything. But anyway, so hi Kelly. Thanks from North Carolina. Say nice to see you. And so what I want to talk today really quickly before I get started, there is some big news that came out recently that came out since I set this topic about the FDA removing the black box warning from vaginal estrogen. Since we're talking about menopause, this is a big deal, and I wanted to add this. So what this means is that the genital urinary symptoms or syndrome of menopause, which causes, difficulty with sex, painful sex, causes, different types of infections like, bacterial vaginosis and yeast infections, but also causes bladder infections, which then can lead to urosepsis. And what urosepsis is actually an infection of the blood that can kill you. So these are things that we don't hear about much because it's menopause. Nobody talks about women's health much, but this is a big deal because one, this is all being prevented, and it can also be helped if you already have it. So talk to your doctor, because now they can't use the excuse that this causes breast cancer, because we've always known that it didn't. I mean, it can't even reach your blood to get to your breast. So this is a big deal. So good evening, Marcy. Good to see you. Perry from Dallas, Texas. Jen from Santa Rosa, California. Nice to see you. All right. Well, I want to talk about metabolic syndrome of menopause because in all this talk about the FDA and all this talk about hormone replacement, no one's really talking about the other things that happen with menopause. Because I've heard several discussions with doctors who have wonderfully fought to get FDA to remove the black box label from vaginal estrogen. And in those conversations, they keep talking about weight gain. They keep talking about belly fat. They keep talking about mood swings. They keep talking about all these things that are related to the metabolic changes of menopause. And so I wanted to talk about that today because that is also reversible. And it is also reversible in a way that doesn't always require hormone replacement. Although hormone replacement does prevent it, and it doesn't reverse some of the things that happen, but it does help. And so essentially, and I've talked about this quite a bit before, and for those of you who are listening for the first time. So what happens when we have hormones? Women's hormones are estrogen, progesterone, and testosterone. All three of those drop in different times. They start to fluctuate a little bit early on in perimenopause. So sometimes they're normal, sometimes they're low, it kind of goes back and forth, and we have symptoms depending on where those hormones are. And so, but when we get to a point where they drop, what happens is that we lose the protection of those hormones against cortisol. Because what happens, and I've said this before, you have cortisol here, you've got estrogen, progesterone here, and cortisol's constantly trying to get in and drive our body. but estrogen and progesterone stops it. But during menopause, this starts to drop. This is our estrogen and our progesterone, and it leaves our cortisol unopposed. And what that means is that it pushes us into metabolic dysregulation. And what metabolic dysregulation means is that our body cannot efficiently take food and make fuel. So what it does instead is it takes food and turns it to fat. It basically tries to push your body towards diabetes, because cortisol in and of itself causes glucose dysregulation, and glucose dysregulation leads to fat production. And the very definition of glucose dysregulation is metabolic syndrome. So it's metabolic syndrome in medicine is a conglomerate of symptoms like high blood pressure, weight gain, and other things. However, when it's in menopause, it's simply caused by a drop in hormones. And so how do we reverse this? We reverse it by starting hormone replacement therapy, because now we know that it does not cause breast cancer. Now, if you have breast cancer and you have a history of breast cancer that is hormone sensitive, then yes, you have to be careful. But if you don't, then the benefits of hormone replacement, the cardiovascular protection, the brain protection from dementia is so high that the benefit outweighs the risk. And so if you start early, the earlier you start, the better. The other that it does, it helps maintain our muscle mass. When our testosterone drops and we replace it, it helps preserve muscle. Muscle is our metabolic powerhouse. So hormone replacement of estrogen, progesterone, and testosterone does a couple of things. It keeps cortisol in check, so it stops that weight gain, especially through the middle. It protects your heart, your cardiovascular system, from heart issues, strokes. It also protects your brain from dementia. But the other psychosocial part, the parts that aren't biologic, are the mechanical things that happen. It helps preserve your energy. It helps preserve your body's ability to take food and make energy rather than fat. It preserves your vaginal lining so that you're less likely to have urinary tract infections. You're less likely to have painful sex. You're less likely to have bacterial vaginosis or yeast infections. So hormone replacement protects you from all of these things. And when it protects you from all of these things, guess what? You feel like yourself. The other thing that metabolic disruption does is it causes mood swings. It causes hot flashes. It causes insomnia. So our cortisol goes up and down all day long. One of the times it's up is about 2 o'clock in the morning. How many times when we reach a certain age, suddenly you have insomnia, and it's always that you wake up at 2 to 3 o'clock in the morning and you can't get back to sleep? That's because your cortisol is already high, it's unopposed, and then it shoots up even more at around 2 o'clock in the morning, and therefore you wake up and you can't get to sleep. I can't tell you how many times people think I'm some kind of mind reader or I can read crystal balls, because I'll say, I bet you wake up between 2 and 3 in the morning every night. And they're like, how did you know that? Because that's when cortisol spikes. And when cortisol spikes and you're in menopause or perimenopause, it causes insomnia. So, but the metabolic syndrome of menopause is basically when our hormones drop, it leaves our cortisol unopposed. Our cortisol becomes a driver, and that pushes our body towards insulin resistance. If you don't have it before, if you're insulin resistant, it will push you towards pre-diabetes. And if you're pre-diabetic, it will push you towards diabetes. And if you're already diabetic, it will make that diabetes worse. And so hormone replacement is one way of fixing that. The other is muscle mass, building muscle. The muscle you build now will protect you from having to use someone else's muscle later. Because your activities of daily living, your washing, your getting out of a chair, your ability to go to the bathroom, your ability to wipe yourself, wash your hair, brush your hair, put your clothes on, all are dependent on the muscle you develop now. Your independence is dependent on the muscle you build now. And so muscle is our metabolic power. And so the more you build, the better your metabolic status is. The third thing that happens, and I call this like kind of the 4M. So you have your mindfulness, which helps keep your cortisol levels down, your hormones or medication, which is hormones, but the other medication is GLP-1s. We are still finding that low dose GLP-1s, because GLP-1s are metabolic correctors. So anytime there's metabolic dysregulation and you use a GLP-1, it corrects it. And so that's why it actually causes weight loss. It's not because it's magic. It works because it prevents the cause of weight gain. It prevents the cause of fat gain. And what causes fat gain is metabolic dysregulation. So you see how this all ties together? So hormones, low dose, GLP-1, if you're already having that weight gain, because like I said, the weight gain in and of itself isn't the problem. It's what it represents. The fat that's being laid down through your middle is also being laid down in other places. And those other places can cause you more of an issue. So if you have, and so the other is people are like, well, how do you know if you're in perimenopause? Symptoms. Perimenopause is not a laboratory diagnosis. You cannot test for hormones and determine if you have perimenopause. If you're having issues with insomnia, dry skin, aches, feeling just out like you're not yourself, having mood swings, hot flashes, you are in perimenopause, no matter what your labs show. And by the time your labs show that you are usually you're in menopause at that point, when they're low enough so that you can detect them in a lab order. And by then you could have prevented all of it. So, this is my soapbox thing, because I just find that so many women are suffering for absolutely no reason, because we have ways of preventing the metabolic syndrome of menopause. Menopause in and of itself, like we said, it used to be, oh, your hormones are just dropping. You're fine. Well, no, that's not really true. There's a reason that women have higher rates of dementia. And this is one of them. We have estrogen receptors on every cell in our body. So when we don't have enough of it, we simply do not function like ourselves. So if you have any questions, this is kind of a quick one today. So if you have any questions, now's a good time to ask. I'm going to say hello to Jen and Kelly and Marcy and Perry. And hi. They think they're making things better, but people of a certain age, we just get confused. Okay. So I'm not sure exactly what you meant by that, but if you want to explain that a little bit, I will, because I think I know what you're saying, but I'm not really, I don't want to assume. Karen, you're welcome. Jen says, HRT question. I'm 62, postmenopausal. I'm on Mounjaro 12.5 milligrams and doing great, helping with lowering my A1C, inflammation, etc. Okay. So what's your question? Oh, my menopause experience was minimal. No hot flashes, definitely high cortisol my whole life. Okay. Should I start HRT? So that really would be a discussion you have with your doctor, and HRT would be protective because you're not yet 70. You're still young enough so that hormone replacement therapy will be protective against bone loss. It will be further bone loss. It can be protective against muscle loss. It can definitely help with any of the other psychosocial. If you're having any vaginal dryness, vaginal pain, urinary tract infections, yes. So there's two types of hormone. There's vaginal hormones, which is vaginally inserted, which just stays locally in the vagina. And then there's systemic hormones, which go throughout the whole body. And so you can choose which ones are causing you the most problem. Now, the systemic hormones are preventative for further anything happening down the line for you, Jen. So what vaginal does is it actually reverses some of the damage that is happening from low hormones. And so what that means is it protects you from later urinary tract infections. And that is important. So at the very least, you should be on vaginal hormones. And if you feel that you're at risk for heart disease, you're at risk for dementia, then systemic hormones should be something. But the GLP-1 is protecting you a lot from, especially Manjaro, is protecting you a lot from the cortisol effects of the drop in hormones, but that's only half the protection. But you could get away without really starting systemic, but unless, but vaginal is something that you should be on to protect yourself from later infections. Question, I am postmenopausal. I am wondering, would hormone replacement cause problems with my endometriosis now that I am menstrual free? It shouldn't. It really just depends on how far beyond menopause you are. So if you're post-menopause, at this point, it's very unlikely to cause you some issues, but that is something that, of course, you can't say never say never. But that is something you definitely want to talk to your gynecologist about, because endometriosis is painful. And I can understand why you do not want anything that's going to make that come back or make it become a problem for you. However, it's not dangerous. Heart disease is dangerous. Dementia can cause you issues. Urinary tract infections. Now, the other thing though, if you're worried about systemic hormones, like things you take pills for, and that your endometriosis, then you can also protect yourself in other ways simply with vaginal estrogen. That won't end up in your bloodstream. That will not affect your endometriosis at all. It only affects your vaginal lining, and it protects you in that way. Oh, Stan said, oh, things systemic would be best. Yes. So just talk to your doctor about that, because that's the best conversation. And what you can do, there is it's called the Menopause Society. The Menopause Society does do certifications. It used to be called the North American Menopause Society, and now it's called the Menopause Society. They certify doctors who are well versed in menopause. So you can start there and check with them. If your doctors are not comfortable, your doctors aren't sure, you can start with the Menopause Society, and actually they have a directory of all the doctors who are certified in the country. The other is, I personally, and I tell everyone to follow Dr. Rachel Rubin. Dr. Rachel Rubin is on Instagram. She has a lot of really good information for patients and for physicians. And so she's a good person to follow. She's a urologist. It's interesting. Well, it's not really surprising, but since urinary tract infections are such a problem with menopause, urologists are leading the fight. And she's one of them. In fact, she's one of the people who really fought hard with the FDA to get the box label reversed. So she's a good person to follow and get information from as well. She's actually my go-to person for a lot of my information. Karen, hi Karen. Dr. Tumor, I do have insomnia, and I actually don't go to sleep until 3 or 4 in the morning. Lately, I have been having hot flashes to the point that everything in my bed is wet. I mean, soaking wet. Oh yeah, I've experienced that. Progesterone will help with that. Progesterone, now a lot of times we'll get hormone replacement therapy, estrogen, and because some people have had hysterectomies, we'll be told, oh, you don't need the progesterone. Well, progesterone protects you from endometrial cancer, or the overgrowth of endometrial lining with estrogen. However, It is also helpful with the secondary symptoms of menopause. It helps with the insomnia. It helps with the hot flashes. It helps with some of the brain fog, which comes with menopause, which is also, by the way, a metabolic side effect. Brain fog is. You ask anybody who's diabetic, they can tell when their blood sugars are off by the way that they feel, and usually it's because they're feeling a bit foggy. It's the same thing. What should the testosterone level be in post-menopause? Well, to be honest, if you hadn't asked me that question, I probably could have told you the actual level. I think it's somewhere around 40. Don't quote me on that. But if memory serves, I just blanked on them. But I think it's somewhere around 40. Um, and when you're postmenopausal, your testosterone's low. In fact, interesting fact, we as women have more testosterone than estrogen, but we don't have as much testosterone as men. And that's why people tend to focus on our estrogen, because we have more estrogen than men have. But our testosterone is actually quite an important driver of our hormone environment. And so and testosterone, especially if you're having libido issues, if you're having muscle loss, testosterone is replacement, and it can be low dose. And basically what that means is it's like 1/4 the dose of what men get, and it's once a month instead of twice a month. We don't need that much to replace it, but it is very helpful to replace it. Kuana Price says, good evening, Dr. Toomer. I have been on Wegovy for over a year and I have lost about 75 pounds. Also, I am 54 years old in menopause, but I am also tired. I have been prescribed vaginal creams, but what do you think about the hormone patches? Okay, hormone patches help with the systemic stuff. So fatigue is one of those things it helps with. Wonderful. Congratulations on taking charge of your metabolic health. Losing 75 pounds is huge. And like I say, you cannot lose that much weight unless it's treating something. And so you took charge of your metabolic health and you have reduced your cardiovascular risk, you've reduced your dementia risk and your kidney issues risk. But that's only half of the protection. You still need to protect yourself from the hormonal side. And from the hormonal side, usually systemic. Vaginal creams will only stay in the vagina. They will not help anywhere else. And so hormone patches, if you're not at risk for if you've not had any breast cancer, or you have, and then, make sure if you do, of course, this is for everybody. If you are on systemic hormones, make sure you get your annual mammograms. Always. Because that's the biggest risk they talk about. Oh, breast cancer. Well, mammograms will detect anything that happens. Self-breast exams and mammograms. Juan, I hope that answers your question. But definitely talk to your doctor about systemic hormones, especially at 54, because you are young, and that would be you'd have a lot of benefit from it. I'm 67 and have had a hysterectomy years ago. Okay, so hysterectomy will protect you from endometrial cancer. So often what will happen, doctors will say, oh, you just need estrogen. But the secondary symptoms of hormone, of menopause, progesterone is the one that protects you from that. A lot of the insomnia and the hot flashes and all the rest, it's actually progesterone that helps with that. So even if you've had a hysterectomy and you don't need protection from hormone replacement therapy, you still can be protected from some of the secondary things from menopause. Oh, hi, Denise from Pennsylvania. Good to see you. And you're welcome, Kwana. That was a really good question. So, anything else? Any other questions? I try to keep these around 30 minutes. I know everybody has busy lives and things they need to take care of. And I don't want to keep you too long, but if you have any other questions, you can ask me now. Or if you think of something later, you can write to me at help@drtumor.com. And the other is make sure that you follow me on Instagram. I'm not sorry, not Instagram, YouTube. I am trying to grow my YouTube channel, so please subscribe, share with other people if you find this helpful. This is being streamed directly into YouTube, so it's right there. You can actually just tag somebody if you know that they think this might be helpful for them. Karen asks, is it safe to take progesterone if cancer runs in my family? That's what I'm afraid of. Okay, so the hormone that you should be worried about is certain types of cancer. Now, this is only breast cancer. It doesn't cause cancer, doesn't have any effect on other cancers, and that's estrogen, not the progesterone. You can take progesterone just by itself to get rid of the symptoms if you're still worried about the estrogen. You don't have to take the estrogen if you have risk, but the progesterone can still be helpful and it doesn't cause any issue. Somewhere in the middle says, I have one. And I'm not sure, because I talk so much, I'm not sure what you're referring to, but I have one. I'm not sure which one you're talking about, but you can share if you want. How do they administer progesterone? Pills or patches. You can get compa patches that have both estrogen and progesterone in them, or you can take pills. My hormone replacement, I take both my estrogen, or estradiol is how I take it, my estrogen and my progesterone in pill form. And the vaginal inserts can be cream or pills or like tablet type things as well. Now, unfortunately, insurance doesn't always cover all types of hormone replacement. So sometimes you just kind of go with whatever it is your insurance covers. Do you recommend birth control versus HRT for perimenopause? Also, does GLP-1s help with symptoms of perimenopause? Absolutely, GLP-1s do. Especially if you have menopausal, if you have any metabolic issue, a history, genetics, because the most common cause of metabolic issues is actually your genes. So if it's in your family, it's just a matter of your genes when your genes hit a certain environment and it just expresses itself. When it comes to using birth control versus hormone replacement when perimenopause, it really just depends on your age. It depends on when your symptoms started and how far along you are, where your periods are. So if you're someone who's already having irregular periods and they're kind of hit or miss, you probably could get by with just your hormone replacement, a low dose hormone replacement. The other is with birth control, the amounts that are in birth control are a different amount that's in HRT. Often they're higher. And so it's not always necessary to have those higher doses. So it really just depends on, you always want to take as little as you can get away with. And so it really just depends on how it's configured, because not all birth control are created equally. They have different levels of estrogen, progesterone, and other things in them. So Karen says, thank you so much. This is so informative. You're welcome. Somewhere in the middle. Oh, I just happened to pop in here. Based on the title, I'm kind of assuming what you're talking about. Literally just in the last couple of days, I have been struggling with inflammation all over. Okay. Inflammation is often related to sugar or glucose dysregulation in our body. There's lots of different things that can cause inflammation. Autoimmune diseases can cause it. Cortisol levels, stress can cause it. The other is overworking joints or just kind of overworking movements. So like carpal tunnel is a form of a repetitive overwork thing that happens. So it really just depends on the cause. There are lots of things that can help. You said, I have never had this before. I'm 42. I do and have been having hair loss, but my bones and joints are so inflamed, I think. Not sure. I would suggest going to speak to your primary care doctor. And the reason is there are other hormonal things that can cause this, like thyroid issues. A lot of autoimmune things can cause this. You want to make sure you don't have lupus or something else. So at 42, you should not be having a lot of inflammation. There's a reason, and you can find out what that reason is. Get checked for diabetes, get checked for lupus, get checked for any um, thyroid issues, anything that can cause hair loss, inflammation, and if, especially if you're fatigued, if you're very tired all the time, if your weight's kind of going all over the place and you can't really control, no matter how little or how, you eat, you're still gaining weight. There's something going on and you just need to get lab tests to figure out what it is. Okay, so Denise says you're having irregular cycles at age 53. I would just talk to your gynecologist, Denise, and find out. I think that because one of the things about hormone replacement, you can actually go to lower doses. And so you always want to go with the lowest dose possible of what you can get away with. And with hormone replacement, you can go quite low. It's a lot easier to go low with a hormone replacement than with birth control. How long does it take being on HRT before you can expect to see reverse improvement of metabolic syndrome, i.e. abdominal weight? So you do not see reversal of abdominal weight. So the metabolic issues with usually it's hard to tell because it's different for every person. However, you start to tell based on the symptoms that you're having or no longer having, I should say. The hormone replacement will not reverse abdominal weight gain. It will just prevent it from getting worse. Metabolic correction using a GLP-1 or using muscle or using meals like high protein, low carb diet, those things can reverse the abdominal weight gain. I hope that makes sense. Once it happens, you cannot reverse it with HRT. It takes another medication to do that. But HRT will stop it from getting worse. One of the things that you'll start to notice with metabolic syndrome, the metabolic syndrome menopause, if you're taking HRT, you'll start to notice that certain things, when you eat, you don't get tired. You'll start noticing your energy levels going up. You'll start noticing that you're sleeping better. When all of those things start happening, then you know that it's working. And again, it's different timing for each person. It's really hard to say. McKinya says, I'm going to start taking a GLP-1 compounded RX. I'm postmenopausal from hysterectomy in 2014. Also taking estrogen in pill form and metformin. Any advice or tips? So if you're taking estrogen, if you're having secondary symptoms of menopause, estrogen works to replace that feeling when you're not really feeling like yourself, but it doesn't do a lot for some of the other symptoms. And so even though you've had a hysterectomy, sometimes progesterone will help with those things. Even though, generally we don't give progesterone because it's to protect the uterus. And if you don't have one, there's nothing to protect. But it does other things that are beneficial. But if you're not symptomatic, it doesn't matter. If you're starting a GLP-1, what you'll start to notice is a lot of the symptoms that you may be having from before, a lot of the inflammation, the pain, the fogginess may go away. A lot of times with medicine, what we do is we start something and then we wait and see. Start something, we wait and see, and then we adjust accordingly. And for every person, it's a little different. And if you're taking metformin, so I'm not sure, it depends on why you're taking metformin. So if you have polycystic ovary syndrome and you're taking metformin, or if you're pre-diabetic and you're taking metformin, it's another reason. GLP-1 and metformin go well together for metabolic correction. So, it sounds like if you are taking all of these things, I really, really, truly hope that they are through a physician, that you have somebody who's monitoring all of it. because one of the things you don't want to do is start piecemealing your healthcare, because you need someone who pays attention to everything that's happening. Can you talk about the risk of blood clots with HRT use? Is that still an issue? No, it's not as much of an issue. And mainly it's because the formulations are different. But of course, that's a conversation you have with your physician. But unfortunately, a lot of us are scared of hormone replacement, and the risk of blood clots is far, 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 far less than the risk of heart disease and dementia without it. Oh, the metformin's for PCOS. Okay, and prediabetes. Okay. Metformin works really well for both of those. The GLP-1 will definitely work for all of those. Um, and so with the estrogen, the only thing that would change if you still are having issues with insomnia or night sweats or other things, then you may just want to add progesterone. Oops, just knocked my table. Okay. Yeah. I mean, it sounds like you're McKenya. It sounds like you have someone good to ask. I don't think you need my advice. You've got, it sounds like you've got somebody who's right on top of it, and then on top of your care. So, and that's, when you have somebody like that, you kind of hold on to them with both hands and both feet if you can, because when you have a good person taking care of you, who really cares and who takes care of all of you, like pays attention to everything, you want to hold on to that person. You really do. All right. Well, we went 36 minutes. So again, if you think of any questions later, write to me, help@drtumor.com. If you feel like this was helpful and you're not already subscribed to my YouTube channel, please go to my YouTube channel, which is youtube.com/@drtumor, and share with other people, invite them to join as well. Um, yes, trying to hang on. Good. All right. Well, I will see you all next Tuesday live right here at 6 p.m. Dr. Tumor Talks. And I also will be putting out some other little videos here and there. I'm trying to put together something more. Well, I always put, if you go to my, where is it? Actually, on YouTube and on Facebook, I always have like little mini videos that go out every single day. And if you look at those, you can always take them to the longer videos. They connect you to the longer ones, where they came from. All right. So good night and have a wonderful evening. And thank you for coming.